Hi everyone, my name is VAcosta and I'm making this video for my breastfeeding experience theory course at BCIT. Today, I will talk about the breastfeeding challenge using the situated clinical decision-making framework, which includes knowledge, cues, judgment, decisions, and evaluation. My topic is all about breastfeeding engorgement with tweens. So what is breast engorgement? It is defined as the occurrence of painful overfilling of the breast when the amount of milk produced is more than the amount of milk removed from the breast. It is an imbalance between milk production and milk demand. It usually occurs on the third or fourth day of the postpartum period when the milk production in the breast changes from colostrum to mature milk. Breastfeeding pathophysiology. A woman's breasts start getting ready to make milk when she becomes pregnant. Breast changes are caused by four main hormones. These hormones cause the ducts and glandular tissue or alveoli to grow and increase in size. Your breasts start to make the first milk, colostrum, in the second trimester. Colostrum is thick and clear to yellow in color. Once your baby and the placenta are delivered, your body starts to make more milk. Over the next few days, the amount of milk your breast make will increase and the color will change to appear more watery and white. The complex physiology of breastfeeding includes a delicate balance of hormones. There are four hormones that help your breasts make milk: estrogen, progesterone, prolactin, and oxytocin. Your body naturally knows how to adjust the level of these hormones to help your breast make milk. Estrogen and progesterone prepare your breast to make milk. Prolactin helps your breast make milk, and oxytocin releases milk from your breast. As you can see from the diagram, when your baby begins to suck and draw your nipple into her mouth, this hormone is released. This release causes milk to be squeezed out of the alveoli into the ducts and out of your nipple into your baby's mouth. This process is called letdown or milk ejection reflex. So what causes breast engorgement? This can happen when milk isn't being removed well from the breast by breastfeeding, pumping, or expressing by hand. Severely engorged breasts become increasingly hard, swollen, and tender. The nipples and areolae can become hard and flattened, making it difficult for a baby to latch onto the breast properly. A mother with a regular breastfeeding routine can become engorged if she cannot nurse or pump as much as usual or suddenly stops breastfeeding. A mother who doesn't begin breastfeeding after childbirth will have several days of mild to moderate breast engorgement. This gradually goes away when the breasts aren't stimulated to produce more milk. Engorgement can also happen when your baby's breastfeeding suddenly drops, either when your baby is starting or increasing solid foods or when the baby is ill with a poor appetite. There are also factors which may place the mother at a higher risk of engorgement. First, failure to prevent or resolve milk stasis. This results from infrequent or inadequate drainage of the breast. Second, small breast size. While small breast size does not limit milk production, it can influence storage capacity and feeding patterns. Mothers with small breasts may need to experience a greater number of breastfeeding over 24 hours than women with a larger milk storage capacity. Third, previous breastfeeding experience. This influences engorgement because second-time breastfeeding mothers experiences greater levels of engorgement sooner with faster resolution than first-time breastfeeding mothers. Fourth factor is mothers with high rates of milk synthesis or large amounts of milk, such as mothers of multiples, may see milk stasis magnified if infants consume less milk, if less milk is pumped, or whenever milk volume significantly exceeds milk removal. And lastly, limited mother-infant contact. Signs and symptoms. Symptoms of breast engorgement happen when the breasts produce and fill with milk but little milk is removed from them. Milk overfills and engorges the breast. If your breasts are engorged, you may notice the following. Breasts are swollen, firm, and painful. If severely engorged, breasts are very swollen, hard, shiny, warm, and slightly lumpy to the touch. Your nipple may flatten out and the dark area around the nipple, called the areola, may be very hard. Your baby may have trouble latching on to a flattened, hard nipple and may not be able to get enough milk out. If your baby is not able to get enough milk, he or she will suck harder than usual during nursing and want to nurse more often. You will also have a slight fever of around 38 degrees Celsius or 100.4 degrees Fahrenheit. For this breastfeeding challenge, here are my 3 priorities. First, feed the infant. Since breast engorgement happens when there is overfilling of milk in the breast, moms should offer their breast to their babies more often or feed their babies more frequently. Second, move the milk. If babies can't breastfeed due to an illness, mothers should learn to hand express or use electric or manual breast pumps to collect the milk and feed to the infant. Third, help the diet. We can help the diet by helping them work on techniques to have better breastfeeding and prevent breast engorgement. Breast engorgement is a common problem after birth and during breastfeeding. You can prevent and treat it at home. You can use these self-care measures to help prevent or relieve breast engorgement. First, nurse your baby regularly. Breast engorgement results from overproduction of milk or underfeeding by the baby. The easiest and quickest way to alleviate breast engorgement is feeding your baby from the breast that is engorged. Ensure your breasts are soft prior to feeding. This allows maximum delivery of milk to your baby. Gently massage the sore spots to soften them. You can do this before and during feeding. A warm compress applied before breastfeeding can also help, but don't apply a warm compress for more than 5 minutes. Third, use a pump to remove breast milk if your baby can't feed, such as during an illness. This allows you to keep your daily routine and you can store this breast milk in the freezer for another time. Your breast will have gotten used to producing a certain amount of milk each day. So it is important to stick to your routine of emptying your breast regularly in order to prevent them from becoming more engorged. Oftentimes, pumped milk that is stored can come in handy at other times. For example, if you have been away from your baby for any reason, someone else can feed your baby the pumped milk during your absence, and it will ensure that he stays on the same breastfed diet. Fourth, take a warm shower. Taking a warm shower triggers something called the letdown reflex, which actually causes some of the excess milk to leak out. This in turn softens your breast and reduces discomfort. Fifth, use cold compresses between feedings or breast pumping. Try cold compresses to help reduce swelling and ease the pain if your breasts still feel painful and are hard to the touch, even after nursing or pumping milk. Apply the compresses several times for up to 15 minutes. Bags of frozen vegetables work well for this method. Next is try cabbage leaves. Cold cabbage leaves applied against your breast is an age-old natural remedy that can reduce breast engorgement. Place the cold cabbage leaves around your breast and leave them against your skin for approximately 20 minutes at a time or as needed. Next, wear a loose-fitting bra. Tight-fitting bras can compress the lower part of the breast to the rib cage. This has the effect of trapping milk in the lower milk ducts and will aggravate the problem. Another is use medication to ease the pain and inflammation. You can get ibuprofen, Advil, or Motrin, or acetaminophen Tylenol over the counter at any pharmacy. These are safe to use while continuing to breastfeed your baby. Follow the directions on the bottle and use as needed to reduce pain and discomfort in your breast. Lastly, seek additional help if needed. Consult your family doctor or a lactation consultant, someone who helps mothers learn to breastfeed, if you would like additional support and guidance in how to manage breast engorgement. If you have increasing soreness, hardness, redness, and or discomfort in your breast, especially if it's associated with a fever as well, seek help from your physician promptly. It could be an infection of the breast called mastitis from blocked milk ducts, which requires antibiotic treatment. For the evaluation, the mother understood the causes and factors of breast engorgement and demonstrated proper breastfeeding techniques to prevent future breast engorgement. This showed a happy mommy and happy babies. Thank you for watching my video, and I hope you learned something about breast engorgement, how to relieve breast engorgement, and how to effectively breastfeed your baby.